The cause of these coin lesions and alopecia areata is autoimmune. So I'm going to ask you something. If you don't stop the autoimmune attack against the hair follicle, what happens when the steroid runs out? A lot of people with autoimmune have multiple reasons why they have generalized hair loss, and I went through some of those. And then the autoimmune attack itself can cause these coin-shaped lesions on your head. Have either one of you had any experience or been on prednisone or steroids, and how do you think it affected your hair? Charlotte?
Yeah, I think it made a significant difference. I was on a pretty much a 20 milligram per day shot of prednisone right before I started the program. And by the time I started the program in January, I was losing hairbrushes full of hair on a daily basis.
So you were taking prednisone like about 20 milligrams every single day. And your wonder, and a lot of other people's wonder, is can daily taking of oral prednisone cause hair loss? And the answer I'm giving you right now is hell yes.
And then what's crazy is that one of the first treatments that I got, after they gave me just this topical steroid thing, is then they actually started to do steroid injections into my scalp. And I even put them in my eyebrows and eyelashes. So it's totally confusing to me that the very thing that they would use to fix it.
But it worked, right?
It worked temporarily.
It's for temporarily. Okay.
I ended up with a huge divot in my head.
Okay. It worked temporarily, but wherever they injected it, you got a divot on your head. The question is, why? Here's the segment we call Stump the Doc. Not. All right. Number one is that when you take prednisone, it actually is a major, massive corticosteroid. It's a steroid. And while it can temporarily boost some of these hormones, it actually really suppresses your own production of a lot of hormones. And prednisone also has an anti-inflammatory effect, but there's a cost to it, huge cost to it, meaning that chronic prednisone and taking it can really actually suppress also your immune system and kill your immune system, putting you at risk for infection. What Charlotte was doing was taking it orally every day for her autoimmune condition and just experiencing side effects of losing hair because it was suppressing many of her hormone function. That's long-term oral steroid use. What Merritt's talking about is when she had alopecia areata in a spot, look, you can't dunk or inject your whole head with steroid. But if it comes in a little circle, can they inject it right in that little circle, temporarily decrease the inflammation to allow enough time for that hair to grow back? Yes, they can, and it can temporarily work. But the reason it doesn't keep working is because what the heck is causing that problem? The cause of these coin lesions and alopecia areata is autoimmune. So I'm going to ask you something. If you don't stop the autoimmune attack against the hair follicle, what happens when the steroid runs out? Comes right back.
Comes right back, yeah.
Right. So it's always a temporary solution. What are you going to do? Inject your head 10 spots every single 6 months. And then what happens? You get into daily chronic steroid use, which then suppresses all your other hormones when you're using it that regulate. Then you got general hair loss, which is what Charlotte had. What's with the divot? Medical mystery. Not really. So one of the side effects when you inject steroids in high dose is what's called fat necrosis. So it causes the fat right where you inject it to shrink. So you get a little hole in a divot. Okay. So you might have some hair grow back, but now you got divots. If it worked forever, I might take a divot or two. Yeah. But the problem is it doesn't, right? For those of you that didn't catch it, 2 weeks ago, I actually did a live training on what are the root causes, hidden root causes of hair loss. If you didn't see it, I'm going to have my team drop in the comment section a link to it so you can catch it later. I went into what the root causes are. I also went into what are some supplementation answers to some of those root causes can be. So check that video out. Also in the copy above, there's a link to download the Transform Hair Loss Guide. So if you want to actually have a summary of some of my recommendations from last week's training, go ahead and click the link and download our hair loss guide.